the mandible, of the entire cranium actually, is going to be primarily controlled via two main mechanisms, which is nasal breathing and chewing. Yes, chewing. If you've ever heard of patients who don't chew enough, no one chews enough. Nasal breathing actually is going to allow for maximal movement of the spheno-basilar joints. When we breathe through the mouth, it doesn't actually expand quite as much. It doesn't drop into flexion the same way. And that causes subtle shifts over time of the way our actual jaw works. So for those of you who are with us and you're studying neurology, we know that mouth breathing or hypomemia which is a part of hypomemia, is going to be highly associated with decreased functionality of our frontal lobes. So it makes sense why we don't necessarily need people just with their mouth open breathing through their mouth. Just from other neurological perspectives, we always want people to be able to comfortably breathe directly through their nose. So we want our patients to actually be performing nasal breathing because it allows for a proper flexion and extension of that spheno-basilar joint, which is key to correcting their actual jawline. Now, one of the other big issues that happens with people now is nowadays people are developing with tooth misalignments that didn't happen. A lot of people in the world of orthodontics like to tell us that, oh, well, it's just genetic. That's why we're seeing all these, that's why we're having to pull teeth all the time. And that's why our teeth are growing in opposite directions. But this doesn't make any sense. We didn't create genetics 100 years ago that made our teeth start growing in mad, crazy directions. We didn't create new genetics that made it so that our mouth doesn't have enough room for the teeth that we grow. So we've seen an increase in between 16 and 18% of the amount of children who have required orthodontics just since, like, I believe since it was 2010, or no, it was 2002. Since 2002, we've seen an 18% increase in the amount of children who are requiring orthodontics every year. Well, what's one of the biggest things that we've changed? Well, we changed the actual difficulty of chewing. So one of the main things that actually holds the hard palate up and forms all the musculars inside your jaw is actually the act of chewing. So we switched our children onto extremely soft foods. They're not chewing hard foods like a carrot. They're not actually having to utilize the muscles of their jaws. And it's causing a change in the way that our palate forms and the way that the rest of our jaw forms. So there's a lot of really brilliant people who came up with specific nasal breathing exercises and the fact that you have to chew hard foods to start to help correct the formation of our jaw lines. And this allows for appropriate amount of room in your mouth, so you don't have to get 6 teeth pulled just because, I don't know, you became an adult. So I highly recommend that patients who are suffering with tooth alignment issues, that we increase the amount of actual hard foods that they're chewing. We increase the work of the jaw. Then we also will have a tongue exercise. Now you can hold your tongue on the roof of your mouth, on the hard palate, while you're performing nasal breathing. You're going to hold this with moderate pressure for 30-second contractions, and this can be repeated anywhere between 10 and 20 times a day. We've seen an actual decrease in the necessity of orthodontics when patients are following these types of exercises. And it actually works brilliantly. That doesn't mean that you're a dentist. That doesn't mean that you're an orthodontist and you are qualified to tell them everything about how the way their jaw is working. But if we know these activities and we know that this patient, or we suspect that this patient is having issues with the way their tooth alignment is sitting, and we want to make sure that that trigeminal nerve is working optimally and providing optimal stimulation to the dorsal cochlear nuclei, then we need to be aware of how this affects our teeth. So nasal breathing exercises, tongue exercises, and hard chewing can actually be extremely important in our patient's ability to recover from tinnitus. And it's not difficult to get them to do it because everyone likes to eat. So you just tell them to eat something that requires a little chewing. Everyone likes to breathe, I'm pretty sure. And you just tell them to breathe through their nose. These are really, really simple things that we can do to improve the way that our teeth and actually our entire spheno-basilar system operates. So we get better cranial motion, we get better stimulation via the trigeminal nerve to all parts of the system. And just remember, our cervical spine is important. Our shoulders are important. Our wrists are important. Our teeth are important, okay? So I hope I haven't just destroyed